but bellies are full and minds are racing, so it's a good time to begin. I'm Mark Reinhardt from Stockholm University, together with Arjen and Magnus Ekengren, helping with this conference. I have next to me Fredrik Benander from the Swedish Defence University, good friend and scholar, and a close practitioner scholar, I think they're called. The topic of the panel now is the pros and cons of centralization for crisis leadership. This is a theme which has been around for decades and decades and decades in crisis management. We were just discussing over lunch. Of course, the pros and the cons of centralization for crisis leadership in an era of protracted crises like COVID takes on a new dimension and prompts new questions. So I'm really happy today that we have I'll say a really diverse group of people to help us answer these questions, and in line with the general aim of the conference and its attendees. We have a mix of academics and we have a mix of practitioners here. I will begin. I'd like to introduce everyone first before we allow you to give a kind of introductory intervention, 5 minutes or so from your perspective. Everybody on this panel diligently sent in some written remarks as well, so that really helped to get the discussion started already in the conference, and certainly in my mind. I want to first welcome Cynthia Renaud, Chief Renaud from formerly the Chief of Police for the City of Santa Monica, California, also a member of the International Police Chiefs Association, and obviously someone who, unlike the rest of us, has ground-level experience in executive leadership during a crisis from a police perspective, to discuss the pros and cons of centralized crisis management, but also some solutions she writes about in her text. We also have Roland Bal from Erasmus University Rotterdam, who's been working on the building of knowledge infrastructures in the governance of healthcare, which obviously became extremely relevant in the last 18, 19 months, and brings us some new empirical data on how leadership works in real life in a public health networks in the Netherlands. So that's going to be really interesting to hear about. Sandra Groeneveld from here in Leiden, actually the Hague campus with the Institute for Security and Global Affairs. She is sorry? I'm sorry, how could I say that? Bestuurskunde was my old department here, so I really made a big mistake there. I'm sorry. Bestuurskunde Public Administration Institute. Okay, me or the panel? That's okay, we're just chatting, so it's when it becomes official, we'll make sure we use our mics. That also means people didn't hear my mistake, hopefully, but anyway. So welcome to you, Sandra, and your expertise on organizational theory and public management. And of course, Jörg Raab, who is from Tilburg University, who we've been discussing the last day and a half with already. Jörg is an associate professor in the School of Social and Behavioral Sciences in Tilburg, and actually has a really interesting take on organizational sense-making in, can we say, sub-Saharan Africa. So a whole geographic addition to the conversation too. I don't know if that's going to come in so deeply in the conversation today, but I still think it's really interesting to hear. So problematizing this either-or question, which is exactly what Roland does in his paper as well, or totally different context, of course, than California, but in Dutch acute care systems during the COVID crisis, how decision-making took place in practice, which is something that Cynthia pointed out. And we're going to go a little deeper into the question of where is this middle ground, Cynthia, you mentioned, and what does it look like in terms of, can we kind of prescribe or engineer that, or is it something that happens naturally, or how could we train better to find that middle ground quickly in a crisis between forward operators and kind of command units? But before we do that, let's hand it over to Roland to say your piece, please.
Yeah, okay, thank you. I should probably start by saying that I'm not a crisis researcher either, although I realized that my first paper actually ever published was on a train accident. But I come from the field of science and technology studies, which does a lot of work on exploding things and other controversies. But then I moved into healthcare governance, and so I'm here probably because we had the opportunity from the start of the COVID crisis to do ethnographic research within first within a hospital, and later within the regional and a little bit national decision making, and especially concerning healthcare provision and the coordination of care across the country, which might again be a little bit different from some of the other talks that were held earlier, because in my talk I will not be focusing on, say, national policies. So, our government in stating all kinds of measures, but much more on the functioning of the healthcare system and the way it sort of dealt with the surge of patients overflowing the system. And what I will be arguing, in fact, sort of my theoretical, if you like, contribution would be that from our work, I feel that the whole notion of centralized versus decentralized decision making is a little bit misplaced. And so I would say that actually decision making is distributed, and it is happening in many different places at the same time. And it's actually the relations between those places that starts to matter. So it's this relationality, I would say, that is the main issue that we should be looking into. And I will, and actually there is many examples from our data that sort of exemplify that. And I want to share, I think I've written down two examples, which I think is too long, so I'll keep it to, I'll stick to one. But before doing that, I also wanted to connect a little bit to a methodological issue and a remark made yesterday, I think, by our Italian guests. I'm not sure if they're here. Reading Tolstoy, and I was struck by that. I always teach Tolstoy to my students because I like it very much. And if you want to understand and about conflict, then you should at least read the afterword of Tolstoy, and especially sort of the Battle of Borodino, where, and I think you mentioned that already yesterday, where Napoleon made all kinds of decisions. Neither of them was followed up, and still they won the war, at least the battle. And that was sort of, this is I think, a very nice illustration of what leadership and centralized decision-making does. Okay. And there's also a methodological point here, because I think that many of the crisis literature comes from looking at centers and the way that they operate. And there is, and I think in understanding how crises work, we have to really be multi-sited. So to travel between all the different places in which the work gets done, in which the decisions are being made, and only then you can see the sort of the relationality and the infrastructural work also going on to deal with crises. So let me give you just one example, which is actually from what we call the second wave of the COVID crisis. So somewhere along the summer of 2020 until, say, December or whatever. And one of the things that healthcare learned from the first wave of the crisis was that there are patients that do not have COVID. So we have regular patients. And they were sort of lost within the first wave. And so there was a whole catch-up program. And when the second wave started, it was clear for hospitals that they don't want to make that mistake again, to not have regular patients seen within the hospitals as well. And so what they did is to, and actually that center was already functioning in the first wave, to set up a sort of national coordination center, which in Dutch is called the LCPS, so I'll stick to that acronym if you don't mind. And the LCPS worked through modeling of the prediction of the amount of COVID patients, modeling of how many of those patients would actually enter up in hospitals, how many of them would go into the ICU, and those kinds of things. And then get numbers from the spread of COVID patients across the nation. But also, of course, it needed a lot of data about what is actually the capacity of the healthcare system to deal with patients. And there, so one of the things that we focused on is how do you know how many beds are there? Because this proved to be a very difficult thing. So even counting a bed is very difficult because you think, you know, a bed is a bed, you know, it's just this thing on four wheels and it has a mattress and those kind of things. But that's not a bed. A bed is also all kinds of equipment that are needed. It's space. It is personnel. And this combination of things is what you need to, you know, to have a patient. But predicting how many beds there are, even on a daily basis, is very difficult because you have to take into account the number of patients that might be coming in during the day, either COVID patients or other emergency patients. You have to look at the program of the operating theater, how many of those patients might end up in the ICU or not, and all those kinds of things. So it was, actually, it's a very sort of what you would call a decentralized system in terms of getting information about the amount of beds. And so, for example, every morning at 9:30, there was a round of calls, first within the 11 acute care regions within the Netherlands, between the ICU doctors, saying, okay, we have so many beds available for the day, and then there was a call across the nation with all the chairs of the acute care regions saying, okay, we have so many beds. But in that process, each hospital, but also each region, tended to buffer because they tended to say, well, you know, we need more beds for possible patients coming in. And so within sort of rationalized, objective data structures and modeling structures of the LCPS, of the National Center, we had all these sort of very local intuitions about how many beds do you actually need. And so the way in which that functioned was actually through lots of telephone calls all day long. People were on the phone all the time, sort of trying to get rid of patients or trying to, you know, maybe entering patients. Am I already on my...
A little bit, yeah.
Yeah?
So I may just wrap it up. We'll keep talking.
Yeah, okay, well, thank you. Yeah, because there's more to it, but what I wanted to say is that, so when you look at the functioning of this system, you cannot say it is centralized or decentralized. It's both at the same time, so it's distributed, and it's actually about the relations and the quality of those relations, whether you get the right flow of information and the right flow of decision making. And so I think my sort of point would be that we need to, and I think that's sort of the forward-looking teams that the previous speaker was talking about. We need to look at the quality of those relationships and the relationality of that distributed system and the sort of infrastructural work that's being done, and who gets, of course, you know, to get input in those kinds of infrastructures and who knows. Okay, and I will leave it there.
Okay, just a quick question. Do you hold that system up, that very close interaction phone-based system that was devised in a kind of model military-like fashion? Do you hold that up as an example of something that we should strive towards?
I'm not sure if it is, well, I think it's a very nice sort of way of it's an example of a type of infrastructure that is relational and that accomplishes something that neither the center nor the periphery can do in itself. Okay. So in that sense, yes.
Okay, great.
Yeah?
I'm pushing an ethnographer to come up with normative conclusions for his research. Not easy. Sandra, please.
Well, thank you. I hope everyone can hear me. Yes? Okay. So it's close enough to my mouth. Well, first of all, thank you for having me, because that's not self-evident, because like Roland, I'm not a crisis expert or crisis scholar neither. I'm a management scholar. Actually, I'm a sociologist by training, and well, coincidentally, I happened to end up in a public administration department. And I like studying public organizations for their complexity. And I have built some expertise on that, on managing public organizations. And this also implies that, well, first of all, I learned a lot already this morning, which made me making notes, even more notes than I did beforehand. And now my speaking notes have become a mess. So I will try to, well, keep it a little bit structured for you. But the other implication of not being a crisis expert is that I have to delimit what I'm talking about and make clear how I approach the topic of this conference. And first of all, when I'm looking at COVID-19, I observe that many people are talking about COVID-19 as a crisis, as an event with a beginning and an end. Whereas I would say, well, COVID-19 could also be seen as an extreme case of a situation of complexity and turbulence. And that's the way I would like to study COVID-19 as an extreme case of such organizational turbulence. And a second remark to make beforehand is about this concept of decentralization. And also you, Roland, you were also already problematizing that concept. And we are scholars here, right? So we always start with unpacking concepts first before we make our point. When we are looking at decentralization, and if we do so in public administration departments and in political science, we are thinking about, well, central government decentralizing towards regional and local governments. Whereas from a management perspective, I'm also looking at the decentralization from the higher echelons of those respective institutions to the lower echelons within those institutions. And this implies that my level of analysis is much more the organization and especially intra-organizational processes than the largest systems. So these are two remarks beforehand, before, well, I proceed to my hopefully structured contribution to this conference. Well, the starting point is that when addressing complex problems, decentralization, sorry for the word, you could also say deconcentration, is required for all kinds of reasons, because complexity requires specific expertise, but also adjustment to local situations. So when we look at, for example, healthcare and safety policy areas, we already see that there have been all kinds of decentralized inter-organizational networks established to address complex problems. Well, and Jörg, you are going to talk about those networks, and also these networks can differ themselves as to the extent of decentralization. But that's your topic, right? But when we are talking about acute crisis, like the outbreak of COVID in the spring of 2020, you could say, well, such acute crisis requires centralization or concentration of decision-making. And the first problem I, as a citizen, observed is that central government in the Netherlands had, well, a difficult job to steer in such a decentralized institutional setup. And I even heard our minister complain about this deconcentration of all, well, kinds of decision-making authority in the system. But also within the ministry, which, well, I happen to frequent now and then, not so often as Paul does, but now and then, they also, well, complaint, you could say, of not having the expertise nor the capacity actually to manage the crisis. So this was a first problem, you could say, if all the handbooks say, well, centralization is needed, whereas you have to operate within a decentralized institutional system. But then the second problem, which we actually did actual research into, we were allowed to, in the process, evaluate the coordinating role of the academic medical center in this region, which is the academic medical center affiliated with our university. And they have a coordinating role in the region, in the healthcare networks in the region. And there we observed, in this research, we observed that decentralization to this inter-organizational governance network at the regional and also local level is not necessarily paired with decentralization to the lower echelons within those institutions. That's what I said at the beginning already. And this implied that this decentralized network governance may still be disconnected from what is actually happening on the ground for two reasons. First, because not all stakeholders are being included in those networks. For example, citizens were not represented. And so also the vulnerable people didn't have a table, didn't have a position at the table. And another implication is that what was being discussed at those meetings was not necessarily what was going on the ground and was not tailored to the local situation. And this is particularly problematic in what you call here a protracted crisis, which requires in the end that organizations are able to adapt and to learn. And other people already have talked about adaptive problems, adaptive leadership, but also endurance. Paul was talking about endurance and also the necessity of this adaptive logic. And adaptivity requires decentralization. This problem between, complexity, the relationship between complexity and decentralization was my first lesson, and then perhaps there is a little bit of time for a second lesson. And that's that I would like to draw the attention to the social dynamics at those decision-making tables. As you already said, Roland, when we are talking about crisis leadership, often one is thinking about those individual leaders, whereas leadership also under such complex circumstances is a shared activity. This becomes the more important if you would like leaders to reflect, right? Because you have to distribute the task, and also reflection is a task, a leadership task to be accomplished. So for that reason, it's important to look at leadership as a shared activity, and we observed, several important activities here, and I want to mention two very briefly. The first one, which was not self-evident, is, have deliberation about the shared purpose. We observed that there were all kinds of assumptions about what the shared purpose was and should be. Whereas when talking to the separate stakeholders at the table, they all defined the purpose, the collective purpose, differently. And a second observation was the importance of psychological safety in those meeting rooms. So the experience of having the opportunity to speak up and also to disagree. And I know that, Paul Hart is in the room. He has been doing research, almost 20 years ago now, Paul, about, the groupthink happening in those collaborative decision-making processes. 35 years. No.
He's much
And
older
you
than
are
that.
looking so
much
young.
older than 20 years.
But perhaps when we are looking at that from a different angle, from the angle of psychological safety, I think we can learn a lot for crisis management. As to, an important leadership challenge is to build such a safe environment in which people feel free to speak up and, get into deep reflection with each other. And I think I should leave it at this.
Great. Thank you very much, Sandra. Okay. I appreciated your memo, especially how you finished the memo. It's a question all of us should be thinking about. What role should formal authorities take in order to more effectively stimulate and facilitate informal leadership so that it enhances local adaptive capacity and organizational capacity in communities? But
I didn't have time to touch upon that bit.
No, but I want to bring that up because it's a great question. As soon as you start thinking about these wonderful solutions like distributed decision making and informal decision making, informal leadership, it calls into question, sure, but how do you design that? How do you engineer that kind of question? But we're going to leave it to some of our more
one sentence. Yeah. Actually, we have trained people in followership rather than leadership. That's the problem.
Okay. All right. Thank you very much, Sandra. And Jörg.
Yeah, thanks for the invitation. I guess I'm the third one who is not a crisis management scholar. I think of myself as a public management organization studies scholar who is interested in inter-organizational networks and the governance thereof. And my introductory remarks build on research that my colleague Patrick Canis and I that we have been doing with the Dutch Institute of Public Health and the Environment since 2014. Mm-hmm. Actually, we did a network scenario study about the outbreak of a new Asian coronavirus in the Netherlands before the pandemic. And we got the scenario relatively right, with one exception. Also in the, let's say, forecast of the RIVM colleagues, we were dealing with hundreds of patients, not 10,000s of patients. So the network structure that we actually described was maybe in effect for the first 2 weeks in March 2020 and then was completely changed. And some of the things Roland has already mentioned. Following Sandra here, trying to make some conceptual clarification. So Hodgcroft distinguishes between political and administrative centralization and between territorial and functional centralization. And I will focus here on the functional and the administrative centralization. So not the political, and I think it's an interesting question maybe for the discussion. If those two things do not go together, what happens? Yeah? Then second, if we look at the functions, we can define centralization as the concentration of power and functions in one or a small group of actors, and then we talk about very different functions: decision-making, coordination, information gathering, knowledge generation and accumulation, implementation, control. And for all these functions, you can ask, are they more on the lower level or on in a central actor? Actually, in the scenario study for the outbreak, we identified 43 different organizations in the Netherlands, basically doing 28 different control measures. And we mapped that in the network, in a network map, and it's pretty much a chaos. So there are no clusters. So no real structure that you can sort of work with. And I think we saw that also to some extent then when the real crisis happened. So the question then is, what are the consequences of centralizing specific combinations of functions? And what happens to actors that conduct these different functions? And one of the questions, I think, and challenges is, for protracted crisis, is the legitimization question. And we see that, I think, also with the Dutch Institute of Public Health. So if you're, on the one hand, a knowledge institute, but also coordinating, implementing, advising, then you will be criticized for advising, but that will also influence the credibility for your knowledge function, right? And so that is, I think, one of the challenges for protracted crisis, which are different from acute crisis. Then a second insight that came out of that work is, and that is an answer to your question in the middle ground. So for me, it's not so much the question of advantages and disadvantages of centralization. It's more the question when and under what conditions, and how does that develop over time. And there is a framework that came out of that research, basically putting three contingencies essential, which is knowledge. So what's the extent of knowledge that we have? Or you can also turn it around and say, how high is the uncertainty? Then what is the scope? How many sectors are affected? How many people? What is it in terms of time? And the third one is the risk perception, right? The higher the risk perception, the more actors will be involved. And that we saw that also in the COVID crisis. And that was also different than, of course, to our scenario, because that was still sort of on a relatively low level. Now, what I would close up with the research challenges, therefore, is which combinations of the functions in the central actor are most prone to role conflicts and legitimacy problems? How can that be avoided or mitigated? What are the general contingency factors for slow-moving crises that can help us determine the complexity of the problem and the most suitable network governance mode? So Keynes and Proven suggested three governance modes that Jeroen already mentioned this morning. And the idea is that the more complex a crisis, so the higher the uncertainty, the lower and the higher the risk perception and the higher the scope, or the greater the scope, the more complex the problem is. You were also mentioning this sort of looking at this from a complexity perspective, and Stavros Tsourides will tomorrow introduce the wicked problems concept to that. And then, depending on these combinations, you need different governance structures that are more or less centralized. And then the question becomes, how do you switch over time, right? So in a protracted crisis that we have now also seen, we have 7 or 8 different phases, not only the waves, but we have also the in-between phases. And how do you sort of switch over time? And also, we know from other contexts that once you have centralized the system, it's very difficult to go back. But actually, the Dutch system for a normal situation is very effective and adaptive as a decentralized functional system, right? And then the question becomes, who decides on that switch, right? I'll stop here.
Okay,
thanks.
Thank you very much. You speak of a much more kind of flexible, adaptable system over time, and I think we started with a discussion of a kind of a more formal, less flexible structure, which is kind of well in place. I want to start with, or I'd like to start as we begin to collect questions. I mean, one question about this, how crisis management scholars, from what I understand, more or less have cautioned against centralized, command and control structures for some time as a bit of a false promise. But the alternative has never been really clearly spelled out too. So, okay, what does a distributed system look like? What does an informal system look like? We write about it, we hypothesize about it. But I'd like to ask, especially people like Frederick and possibly Cynthia as well, and others in the room who have close ties to practitioners, how do you design a system which is just beautifully distributed, decision-making wise, and where you can kind of see more or less where decisions will be made? Because of course, the higher ups, the political class wants to know where those things are. Can you actually design a system like this in advance? It's much easier to do centralized. So how do you design or engineer this alternative?
Yeah, that's a big question. I think, we all buy into that most systems are distributed one way or another, but we also have seen historically how when crises happen, there's something going on there that we can call centralization, right? And so is that a feature or is it a bug? Most people seem to think nowadays that it's a bug. Mm-hmm. So how do we deal with that? And one of the things, if you look at this from the top, there's conflicting motives, so to speak. So you don't want some, unshaven monkeys in your lap. They can deal with it down there, so we have a distributed system, right? But you also realize that some types of decisions sort of acquire a strategic importance, And so you want to sort of have control over them. And that's a problem. And you also see the accountability processes starting. So if I'm going to get hung over this problem, I'm going to want some kind of control over it. And so there are these, tendencies that will push centralization. And my sort of not very clear answer would be to say, here's how we're going to deal with this, even when the going gets tough, so to speak. And we know that sometimes we're going to have sort of uncontrolled centralization because, political realities will call for it and so forth. Okay, fine, we know that's not a good thing, but we're going to try and avoid it as much as we can. We're going to see that the system can function as well as possible, because once we know one thing is that if we centralize more decisions, less things are going to get done, right? Because the higher levels can't deal with all the clutter that is involved in the situation. So I think, on the one hand, it's sort of an unsolvable issue, the way you framed it. On the other, we can sure as hell get better at it, so to speak.
And what you tend to see, at least in European countries, is the impulse of upscaling or centralization during a crisis tends to stick after the crisis when we reform crisis organizations, right, to bring them closer to the prime minister, make them, that's happened in several countries in this room right now. So it's kind of the opposite in some respects, from my limited view, is happening compared to what we're hearing from the panel. Now, Cynthia, great, thank you. I think that informs the discussion a lot. And I'm looking at Roland a bit, because I think your findings, your ethnographic findings of how decision-making played out in these hospital networks, for lack of a better term here, it all sounds, in many respects, wonderful. I mean, it's a very kind of distributed decision-making system where the structure allows for the gathering of experience and for reflexive decision-making amongst a wide group of actors and such. But I mean, who do you hold accountable for that system? Who do you hold accountable for that kumbaya system when it breaks down and something goes wrong? If decision-making is distributed and you can't really see where the decisions were made, and as Cynthia and Frederick have pointed out, someone needs to hang once in a while for a decision. So how do you, it gets to the legitimacy question, which Cynthia brought up, and I would term it in forms of accountability. Who do you hold accountability for these much more informal distributed systems?
That's an interesting question. Let me just one comment towards the notion of centralization and building of systems and those kind of things, because I think I fully agree with Cynthia in the sense that you can design systems beforehand and you can say it's centralized or whatever, but the thing is, it's not going to help you during a crisis, neither to make decisions nor to analyze what's going on. Because you would be focusing on the sort of the formal structures and you forget to look at all the rest. And all the rest is more interesting. And so this is why I also started with the sort of methodological notion that but of course, I'm an ethnographer, so I like mess. So who's accountable? And there is many ways in which we can talk about this. So one of the things is, of course, that, and I think already Paul mentioned that and others mentioned that as well, and our minister even said it, that at least in the Netherlands, but also in some other countries, we have decentralized healthcare. So the minister is actually accountable for everything that happens within healthcare, but has no instruments, no formal things that he can do, or she can do, now it's a man, but although we had a man and a woman, to actually influence the system. So it's completely dependent on whatever is happening within the hospital networks or within the healthcare networks. The only thing that he or she can do is to sort of talk to them all the time, right? But in the end, yes, even constitutionally, the government is responsible and so accountable. So who will be sent home is the minister. And then we'll get another one, and with the same. So the minister is dead. Long live the minister. But accountability, of course, is also, and I think maybe related also to a thing that Paul said, because this infrastructure is, of course, not innocent, right? So what the infrastructure which the LPCS builds does is actually, it focuses attention towards the hospitals. So every day we get bombarded by how many people are in the hospitals, how many people are in the ICU, how many infected patients do we have, and this is what's going to constitute the crisis, right? Up to the day until now, even the whole vaccination policy discussion is very much focused on this number, and so the numbering practices that perform the crisis in a way, and that so this system is very powerful. It's actually within the infrastructure that power is built up to frame, but actually constitute. So it's an ontological thing. This is what the crisis is, and that, of course, is not innocent, because there is many other aspects of the crisis that might have gotten attention that don't get the attention that they might deserve because of sort of the power of this infrastructure. So, yeah. Right. And nobody is accountable for that, I'm afraid.
Right.
Yeah.
Right. And it's hard to imagine a minister who could get the sack over a system which she or he has very little control over. So I can see the politics creeping in once again. I think Arjen might want to chime in on these points. We also have Olivier calling in from France. Arjen defers his time slot to you, Olivier. So please, the floor is yours. And of course, anyone from the panel who'd like to chime in, just signal. But Olivier, please.
Okay, thank you. One of the advantages of centralized crisis management is the capacity you have to be able to have the big picture, to capture and be able to have the wide vision of what is happening. And what strikes me and also a second advantage, referring to what we were discussing this morning about time pressure, is the fact that, well, being at the top, you also have the possibility to ease the time pressure and be able to sort of see longer term. What strikes me in the current crisis, at least once again from the French case, is the fact that centralization went along with decisions taken too much details. I mean, the center was preoccupied with details that should not have gone up to that level. So, for instance, last Christmas, the president himself decided on whether we should be selling Christmas trees out in the streets again, which is probably not a decision that should be taken at a central level. So what we see is both centralization, excessive centralization, and at the same time, both being caught up with details, not getting the big picture, and having no capacity to anticipate, to sort of try to project themselves in a week, in a month, and 3 months. So I think that really, for me, the question is how do you make possible at a central level this capacity precisely to take a step back from the operations and be able to have this capacity to anticipate, which has been really lacking, it seems to me, in many, many countries over the last year and a half. Thank you.
Good question, and especially appropriate in the protracted crisis we're talking about here, where there's no excuse not to take that step back and have a reflection, because this is not a terror attack. This is not an armed shooter situation. This is a longue durée, to use your language, Olivier, kind of crisis. And actually, that prompts a question which, and I'm sure you have responses to, Olivier. But I mean, this conversation so far is very much assuming that we're talking about the old-fashioned kind of crises, the sort of the discrete crises, and limited in time, high pressure. What kind of decision-making do you want in place? Which is obviously an acute question for those kinds of crises. But what happens with COVID? Is this question continue, the centralization versus decentralized decision-making, is that relevant at all in a COVID kind of crisis? Or do we have the structures already in place for making decisions? And if we have these discussions, it's not about crisis, it's about governance, right? So I just wonder, is this relevant at all for COVID? Perhaps we can fertilize that discussion by what are actual experiences in different member states, at least in Europe and around the world, during COVID. To what extent did things centralize or decentralize, change over time, as Jörg is encouraging us to encourage? So anyway, thoughts on, is this even a relevant question a crisis-relevant question under COVID. Jörg.
Definitely, definitely. So from our research, I mean, the structure that we discovered, sort of pre-actual crisis or pre-actual acute crisis. I mean, the Public Health Act in the Netherlands foresaw a certain structure already, and so it turned out not to be adequate for the scale. And then you would have to improvise to some extent, and that what we saw was a political centralization in an extra constitutional body, the Sunday Katzhaus meeting. And I would say that we have to really make this distinction between acute and a protracted crisis, where you have time to maybe even run exercises again, right? And build that structure not top down but organically, right? For the next wave, for example. So yeah, I think I would definitely say it's more a governance question, and how do you sort of, what governance do you use in which situation and over time, than rather sort of this focusing exclusively on the acute phase.
Yes, perhaps to add two other points to this, because I completely agree with you. First, well, but I didn't empirically examine this, but sometimes I feel that people in practice, they experience some advantage of calling something a crisis, because they can keep those structures in place. So I think that we as scholars also should be critical on what we call a crisis, and what we, how we should reflect on what's happening now. Of course, COVID-19 was a crisis, and perhaps also is, because it's threatening our systems. But what do we have to manage then? Do we have to manage COVID, or do we have to manage our systems and change our systems if they are not, that resilient that they can cope with this? And this also ties into what you were saying, that also when calling a situation a crisis, people with the greatest power are the defining stakeholders. And what we have seen in the healthcare networks, that the hospitals were at the forefront, and they were able to define the indicators of successful crisis management. So, and this linkage between having advantage of calling something a crisis, and also having the power to define the indicators of crisis governance success, is something we should be very critical upon. I think that was my first point. The second point I wanted to make is that, and I don't want to sound critical, but the questions you are asking us is about systems and structures. Well, we already have revealed ourselves as other types of scholars, right? Looking also at behaviors. So this question about decentralization and centralization of crisis leadership or crisis management is at least not only a question of what kind of system should we have in place, but also what is being done where. So what kind of behavior do you want to see at the different levels? And then, of course, strategic issues, and also reflection on what changes are to be made in our systems. These are really strategic themes, which I hope at the Katshuisoverleg in the Netherlands is being dealt with, but I'm afraid they are only looking at Excel sheets and the number of patients in the hospitals. Whereas, on the other hand, you want to have professionals on the floor in hospitals and homes for long-time care, inventing solutions for difficult situations, and then discover together what kind of solutions can be scaled up to a greater number of those institutions. I hope I make myself clear.
Yeah, fair point. But I mean, the last point especially is the improvisation argument, which is often used to argue against centralized decision-making structures, to let the front lines or the forward command, as Cynthia would put it, allow them to innovate and improvise based on the needs of the moment.
So fascinating discussion, and I was reflecting a bit based on my own research on of course I studied the blue light services, so how the police and the fire department try to function in the system that needs to be central at some point, but decentralized at other points. So as one of the main ideas that we encountered is what made more effective command is when people switched during a crisis situation or response operation between centralizing command and then decentralizing, giving it away, giving this, so to speak, giving over the stick. So the frontline command Cynthia was talking about, and then again somebody else taking it back up and taking the lead over, and that seemed to create more of a dynamic system. And I was triggered by that by your examples, Jürgen, on of course your network pictures that you send around. And my question would be, because we were talking about centralization and decentralization a bit more as stable states, but from the process perspective, do you see that as well, for instance, in your network studies, or Sandra, in your work in the hospitals, that the centralization is actually shifted around in the system, therefore making it a more distributed system? You recognize that, or is that something that is not the case in COVID?
Well, that idea of switching and layering came actually out of a study of the Düsseldorf emergency response system that I was involved in. And there you could clearly see that, even though what also in the terminology you used this morning we would call a lead organization was basically the same for acute crises, right? So if there was a bomb from the Second World War, then it was clear who was in charge leading that operation. But for example, for other types, it was more of a shared governance structure. What I have not really seen yet in sort of the types of crisis management that I've looked at, that you have sort of a rotating lead organization model. I think this is what you are referring to, which would be an interesting question. But then you come back to Sandra's observation of capacity, right? So it's very difficult if you build a organizational capacity in a lead organization, and then you sort of have to shift that. So that, I think, has practical problems, even though I think from a commitment perspective, that might even be advantageous. I agree with that.
Sandra, did you want to respond as well, or?
Yes, but I was still thinking, because your question is, well, encompassing a lot about this switching between centralization and decentralization. You can well, understand this question in different ways. One observation from our research in the academic medical center, and especially its coordinating role in the network, is that during the acute phase of the crisis, this network started well to work very hard, but it implied quite a large extent of centralization within the institutions, for example, also within the hospital itself. And only when the crisis structure was left, right, and the system the crisis structure drew back, there emerged more room within the respective organizations for, well, reflecting on what happened and what kind of solutions should be kept. So in that way, it kind of worked. But on the other hand, what you see then happening is that organizations intend to fall back to the default status. So then there is no centralization anymore, but also not so much learning is occurring neither. So, is that an answer to your question or not?
Yeah, I think it triggers an interesting thought. So is it like we had this same discussion in the last panel, right? So is it helpful to take a more temporal or spatial dynamic into account when thinking of these dynamics? And based on your answer, we say we know it matters because we can see something is in there, but we don't have the language or the maybe the conceptual repertoire to really pinpoint what we see there.
Yes, well, we can talk it over a coffee next week or something. Yes, we are neighbors. But another type of answer to your question would be, well, you are talking about switch between centralization and decentralization, and then again you are assuming that these are fixed entities, whereas I would say we have to look at what should be centralized and what can be decentralized and vice versa. And so then it's not about switching between centralization and decentralization, but it's about looking at different streams of activities happening when and where. If I make myself clear,
so.
but Roland understands what I mean.
Right. No problem. I'd like to hear from Roland. I know we have Renate Meyer there who would like to throw in a question as well. Is this what we call a two-fingered intervention? You want to respond directly to the last comment briefly, and then we can move on?
If that's okay?
Sure, briefly, please.
No, because, sort of elaborating on you, because this was exactly what I was going to say, that, asking the question whether things should be central or decentral and how that should evolve over time, still assumes that there is a center and a periphery. And I think what I was trying to argue was that we should get rid of those notions and try to think about distributed and relational decision making. And so even when I look at the hospital and you say, well, decision making was centralized, well, it only explains very little about what actually happened within the hospital to look at the decisions made during the crisis management team consultations every morning from 8 to 9. Yes, those meetings were there. Yes, there was a lot of information on the table. Yes, decisions were made, but it does not explain what's going to happen during the day, right? So, and the infrastructures in place, also the sort of relationality. For example, the microbiologists had people running around the hospital all the time. Talking to people, seeing what they were doing, collecting information, talking, okay, what are we going to do with the cleaners? We need the cleaners, but they don't want to work anymore if they don't get protected. Okay, what are we going to do? All this sort of constant back and forth, and yes, there were meetings, and yes, they explain a bit, but if I want to understand what's happening in the hospital, it's really not enough to look at those meetings. I have to look at the relations.
Thank you very much. Renata?
Well, thanks so much to all the panelists for the fascinating conversation that you're having. I'm thinking that there's, if we think of what we want to achieve in situations like that, and with questions of how the decision-making structure should be organized, is that these systems need to have the capacity to act. They need degrees of freedom. They need rooms to maneuver. So, and there's all kinds of different ways of setting up such a structure. And we've heard so many here and so many great examples from central, decentral, dispersed, layered, etc. Would it be possible to come up with situations or phases of the crisis or opportunity structures that should be in place for a certain type of setup of such a decision-making structure to work better than another? Because, I mean, dispersed leadership works if if you can actually disperse it to a number of people that are able to take decisions in a place. If you do not have that infrastructure in place, or if you do not have the people in place, then it cannot work as a dispersed, and a more centralized will work. So I'm thinking, like, I hear so many examples, and there is so much knowledge in this room that I think we could maybe offer a more structured approach, or aim for a more structured approach, to say whatever, in which temporal phase or in whatever opportunity situation, which type of decision making would work. So that is one observation, and the second is that in the crisis operations centers, most of the time people are summoned that have a day job as well. They have normal responsibilities as well. And I think that we must not forget that somebody has to make sure that their normal tasks are also fulfilled. Like whatever, you have the chief of security and organization there, you have the chief IT, the CIO there. You have the medical director of the hospital there, for example, in the Vienna situation. But these people have a normal job as well, and they cannot work 24 hours a day. So that also needs to be organized when we're talking about decision-making structures.
Thank you.
And I would like to hear the panel's ideas and thoughts about that.
I think your first point especially challenged us, not only in the coffee break, but in the weeks and months ahead as we carry forward the agenda. I'm afraid we're going to have to draw it to a close now to give people proper time to stretch their legs, have a coffee for the next panel. I want to thank everybody today who was willing to give their time.